Hi, a very good evening to all of you. Today we are going to discuss the case note of Mr. David Taylor, a 38-year-old landscape gardener who has the problem of damaged medial cartilage of the knee. Now let's go ahead with the writing task. Here is the writing task. I can see the writing task here. You are Miss Catherine Adams, Mr. Taylor's nurse in charge. So you are the nurse in charge of Mr. Taylor, the patient name. The patient has been under the care of his GP, Dr. Peter Perfect, at Lakeside Hospital, Churnside, Melbourne, where you work. So you are working at the Lakeside Hospital, Churnside, Melbourne. Now, you have been asked to write a letter to the orthopedic surgeon, Dr. James Brown. So, Dr. James Brown, he's the surgeon, and he is in Churnside only, nearby, and you have to contact Dr. Brown's receptionist. You can see there. You have to contact Dr. Brown's receptionist. You have contacted right now, and you have arranged an appointment for Mr. Taylor. So the appointment is made on 21st of November 2010, and today's date is 7. Let's go in detail with the case from the very beginning. Now, it's a 38-year-old married landscape gardener, and today's date is 7. It's very clear. And he has no personal injury insurance, no insurance. So what we can see is that he was active, he enjoys sports, and he is a chronic smoker. You can see 20 to 30 cigarettes per day he smokes, and drinks around 1 to 2 cans of beer and more on weekends, Sunday and Saturday. And the past medical history shows that he has left inguinal hernia, and the operation was done in 2008. Next relevant data. That was on 12 August 2010 this year. He presented to the GP with complaints of left knee joint pain and swelling, and difficulty in strengthening the leg. So 2 complaints. So he has developed this particular thing as a part. He has a history of twisting his leg, his knee joint. 6 months ago when he was playing tennis, and this is the cause, how it happened. At that time, the joint was painful and swollen. When he played tennis and he got injured, he got his leg twisted. It was managed with analgesics, that's painkillers. But Mr. Taylor was not able to do his work productively because his injury was making some problems. Now he started having some financial problems to repay his house loans, and family need to support your family with finance, with money, 3 children, problems. Now when we saw him, assessed him, we have observed the limb there, and we have observed a slight swollen area in the left knee joint, and we observed a tender spot on the medial aspect of the joint. You can see the vitals normal, X-ray normal. So we have given the medicine Voltaren 50 mg. After giving advice to stop smoking or reduce smoking, he was asked to come for the review if there is no improvement. Definitely on 20th August, he again presented because he had no improvement. Intermittent attacks of pain and swelling. Again, the problems. Even though he reduced the number of cigarettes and he continued the medicines, that is Voltaren, he still had swelling, he still had tenderness, he still had impaired range of power. So pain was there intermittently, swelling was there intermittently. He took this medicine, but still he had the problem. The swelling is there. Now we are suspecting him an injury of medial cartilage. And to confirm this, we have ordered an MRI. Still, the analgesic Voltaren is continued, and the review was after a week. Now, 7th of this month, that is the month you are writing. So today, that is what we have seen is we can see the limb intact, and he's desperate to resolve the problem. Now he's very anxious. His weight increased by 5 kg. Even though he has got his pain reduced, there is swelling, there is limb. Now, no further complications, no new complication, but he has got, you have got, your report came, that is damaged medial cartilage here. Based on this information, he has some crisis there. So based on this information, you are writing a letter to orthopedic surgeon, Dr. James Brown, to remove damaged cartilage in order to prevent future osteoporosis. So in order to prevent future osteoporosis, we have to write a reference letter to orthopedic surgeon, Dr. James Brown, to remove the cartilage. Now, let's start. That's today's date is 7 November 2010. So we can cross-check. Yes, it is 7 November 2010. The address is clear. James Brown, it's here. James Brown. Yes. 1238 MP Road consigned. Okay, everything is correct. Dear Dr. Brown, patient's name is Mr. David Taylor, 38 years old. Very good. It is exactly the same. David Taylor, 38-year-old. Okay. Up to that's clear. Now I am going to write something here. I am writing to refer Mr. David Taylor, a self-employed landscape gardener who has been complications of damaged medial cartilage on his left knee joint. So instead of starting like this, I'm making a small change here because you are asked. You have been asked to write a letter. So you are asked to write a letter, maybe by your GP. So you are writing. It was an ordered letter. So let us change the phrase there to be more precise. I have to say, the purpose of this letter is to refer Mr. David Taylor, a self-employed landscape gardener. So why we have written here his profession is because you are not going to write his social history in a separate paragraph, because we have to write his medical history which led to this particular surgery. So we have a bulk of data there, so we are not going to write the social history, which is not so relevant here for the surgeon. So I'm skipping it. So I have to say that somewhere I have said the thing, he's a self-employed landscape gardener. He's not employed, he's not getting a fixed salary. If he's working, then only he'll be having his salary. So self-employed landscape gardener who has complications of damaged medial cartilage. You have pain, swelling, all these things. So he has complications of damaged medial cartilage on his left knee joint. Where exactly? It is in the left knee joint. He requires its removal to prevent further complications. So what he requires is that the removal of this particular cartilage to prevent further complications. The first part, the purpose part is clear, perfect. Now let us go ahead with the first particular paragraph. We are presenting it this in a chronological order from the day first, because this was progressing and what has led to this surgery. So you are going to say the medical history from the very beginning in the chronological order, that the first visit was there on the 12th of August. So that's why we are going to deal with this. This is the thing here. Here is the first visit. So you're going to start from that area. So after 12, we'll be going ahead with 25. After 25, we'll be going ahead with 7. This is a chronological order. We are just briefing the medical things here, the history and the current situation at last. So this is our plan. Let us go ahead with the first paragraph. That is the first visit. First presentation was on 12th of August 2010, complaining of pain and swelling in his left knee joint associated with difficulty in strengthening the affected leg. So he had problems in strengthening the affected leg, and he had pain, swelling. This was his complaint when he came to his GP on 12th of August 2010. Now, earlier, 6 months ago, he twisted his joint while playing tennis, resulting in pain and swelling. And this was resolved by analgesics or painkillers. So we have written all these things in just a single sentence. So you can see here what happened to him. He has got knee joint pain and swelling and difficulty in strengthening. And what has happened is that a twist has happened 6 months ago. It was painful, and those things were regulated or relieved by the painkillers. All these things up to this point we have written in 2 sentences there. Within 2 sentences we have used the comma there to join the parts. So many parts are there. about 6 months ago. He twisted his joint while playing tennis. It resulted in pain and swelling, and it was resolved by analgesis. There are 4 or 5 matters there. We have all consolidated into one sentence as using the punctuation comma. On assessment, he had limb and tender spot was identified in the medial aspect of the knee joint. This objective observation, what we have seen, the subjective we have said already. Now, let us go ahead with the next visit, that is on 25th August. Let's go and see what happened in 25th of August. You can see that intermittent attacks of pain and swelling, but no fever. He reduced his smoking to 15 from 30. Now swelling is there, but the flexion extension there is no problem there, but you can say still you have the tenderness in the inner side. And what we have ordered is we have ordered an MRI, and we asked the patient to come after a week. So let us go ahead and see what is there in the second paragraph. When Mr. Taylor came for the review on 25 August, he reported intermittent attacks of pain and swelling despite having Oltarin 50 mg. So despite having Oltarin 50 mg, which was prescribed during his initial visit to us on 12th August, despite having this, he had intermittent attack of pain and swelling. Examination revealed impaired range of power. We examined, we have seen impaired range of power, including passive and active movements that we have seen there. Therefore, an MRI scan was advised. I can say it clearly, it is ordered because it was given ordered there. I have to go with ordered. Oh, okay. And he was asked to come with the results. Okay, this is what you can see up to that point. Review after the investigations. On 7th, now this is today's matter. Limb still present and he's very anxious, desperate, weight increase. So now new complications. So let us go ahead with that particular part. Today he came with the imaging report, which confirmed that the cartilage damage. So where the cartilage damage occurred, it confirmed, although his pain was reported to be subsided, he said that his pain got subsided, but other symptoms remained, it existed. In addition, he had gained 5 kg of body weight. So he gained 5 kg body weight. Clear. So the matter up to here is divided into 3 paragraphs. The first one is 12, the next one is 25, and today that is 7th of November. Now, it would be appreciated if you could attend Mr. Taylor on 21st November 2010. So I have already, you can already see in this thing, you have contacted the receptionist of Dr. Brown and already arranged the appointment on 21st. So it would be appreciated if you could attend Mr. Taylor on 21st as per the appointment, because the appointment was already made. According to the appointment, you please meet him and carry out the surgical intervention to resolve the crisis. So he has some problems here. So please resolve the crisis and to prevent further osteoporosis, no future osteoporosis. So the matter is clear. So many of the students, they skip the date there, 21st November, because that is the date of his appointment. So it's something very crucial. It's something which we have to include in the case. So in the letter. So that's the way we have carefully written. It would be appreciated if you could attend Mr. Taylor as per the appointment and carry out surgical intervention to resolve the crisis and to prevent future osteoporosis. Now, if you have any further queries regarding Mr. Taylor's condition, please do not hesitate to contact me. Miss Catherine Adams is not the registered nurse. I think she is the nurse in charge. So I can say she is nurse in charge. Nurse in charge. Oh, she's a nurse in charge in Lakeside Hospital, Chinside. So she is the nurse in charge in Chinside, Lakeside Hospital. So the address is also given and the letter is complete there. So that is the end of the explanation. So we have arranged it in, we have given a proper purpose paragraph, and we have divided to 3 paragraphs. The first one was the initial visit. The second is the first review, and the next review after the MRI, which confirmed the diagnosis. And that is the end of the explanation here. Thank you.